Pituitary stalk interruption syndrome is a very rare congenital abnormality of the pituitary gland. The pituitary gland is an endocrine gland that sits at the base of the brain, so it sits kind of in the middle of your head and is attached to the brain by a small stem or stalk. Most of the pituitary hormones are stimulated by hormones that are secreted by the hypothalamus, which is higher up in the brain. And those hormones go down the stalk and stimulate the pituitary gland and cause it to secrete the hormones that it secretes, with the exception of prolactin, which is actually inhibited by a substance made in the brain. So in patients with pituitary stalk interruption syndrome, they have hypopituitarism, their pituitary hormones are low, they may have an elevated prolactin. Because all the pituitary hormones are low, patients who have this disorder, which by the way is exceedingly rare, it occurs in less than 1 out of 1,000,000 births. So in these patients, because they have hypopituitarism, they often have short stature because of lack of growth hormone. They'll have delayed puberty because of lack of sex hormones, and they can develop hypoglycemia because of lack of cortisol. It's not entirely clear what the cause is of PSIS. It was thought that it might be caused by some kind of physical trauma during childbirth, because there was a higher incidence in people who were born by forceps delivery and people who were born breech. But more recent data thinks that those methods of delivery are actually a consequence of the disorder and not the other way around.